Welcome to the first aid training video. We know that a construction site can be a very dangerous place. That is why, throughout the industry, there is a strong emphasis on safety training and the use of appropriate protective equipment. However, accidents do happen, and people might experience health emergencies. In this training video, you will learn how to provide the proper and effective help before a qualified health worker is available or the victim arrives at a health center. A well-stocked and functional first aid kit include sterile adhesive bandages in assorted sizes, sterile gauze pads in assorted sizes, hypoallergenic adhesive tape, scissors, tweezers, needle, ACE bandage, Mostyn towels, antiseptic, splints in assorted sizes, petroleum jelly, assorted sizes of safety pins, antibacterial soap, antibiotic ointment, latex gloves and face mask, sunscreen, aspirin and or ibuprofen, ice pack, thermometer, tongue blades. Let us now look at the many types of injuries that can arise and how to treat them. Puncture wounds. Although painful, it may look harmless, but puncture wounds carry a risk of infection and, if left unattended, can result in serious complications. Consult a physician. If the injury is minor, clean it with soap and water and apply an antibiotic ointment such as Neosporin to prevent infection. Shock. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. This can damage multiple organs. Shock requires immediate medical treatment and can get worse very rapidly. A person in shock has extremely low blood pressure. What to do until medical help arrives? Check the person's airway, breathing, and circulation. If necessary, begin rescue breathing and CPR. Even if the person is able to breathe on his or her own, continue to check rate of breathing at least every 5 minutes until help arrives. Keep the person warm and comfortable. Loosen tight clothing. Do not give the person anything by mouth, including anything to eat or drink. Do not move the person with a known or suspected spinal injury. Do not wait for milder shock symptoms to worsen before calling for emergency medical help. Burn. Burns vary greatly from a fairly harmless sunburn to a potentially life-threatening third-degree burn caused by open flames or electrocution. Here is how to distinguish and care for each. First-degree burns frequently have some skin swelling and redness. Before treating a minor burn, cool the injured area to lessen pain and swelling. Dress the burned area with loosely wrapped sterile gauze and apply a moisturizing lotion or aloe vera extract. Second-degree burns will result in deeper, more intense redness of the skin as well as swelling and blistering. Treat it as a first-degree burn, but with extra care. If a blister breaks, use mild soap and warm water to rinse the area. Third-degree burns may appear and feel deceptively harmless, as the victim may not feel much pain due to complete destruction of all layers of skin and tissue as well as nerve endings. It may appear charred or ash color and will instantly start to blister or peel. If the victim's clothing is on fire, douse him with non-flammable liquid. Call for doctor. Do not remove burnt clothing from the victim, as this will expose open wounds to the elements and potential infection. Electrocution. Electricity passes through conductors or any material that permits electrical flow. Minor electrocution is a frequent household hazard because people are excellent conductors. Severe burns to the skin and surrounding tissue can also result from extended contact with a direct source of electricity. In the event of electrocution, do not rush to assist the victim until you are certain that he is no longer in contact with electricity. Otherwise, the current may pass through the victim directly to you. Turn off the source of electricity. or use non-conductive materials such as plastic or dry wood to separate the source of electricity from the victim. If the victim looks pale or faint, he may be at risk of going into shock. If the victim is unconscious, begin to perform CPR. Fractures, broken bone. A fracture may not always be obvious as most breaks do not result in compound fractures, bone protruding through the skin. Typical symptoms of a fracture are immediate and excessive swelling. Injured area appears deformed. The farthest point of the injured limb turns blue or is numb to the touch. Even slight movement or contact to the injured area causes excessive pain. Seek medical attention and immobilize the broken bone with a splint. Keep the victim from moving and until an ambulance arrives, remember eyes. I is for eyes. This will keep down the swelling and reduce pain. C is for compression. If the wound is bleeding, apply direct pressure with a clean cloth to reduce blood flow. E is for elevation. Try to keep the injured area as high above heart level as possible. This will reduce blood flow to the injury and minimize swelling. Cardiopulmonary resuscitation, CPR. CPR is a life-saving procedure that is performed when someone's breathing or heartbeat has stopped. CPR is a combination of rescue breathing, which provides oxygen to a person's lungs, chest compressions, which keep the person's blood circulating. It is during those critical minutes that CPR can provide oxygenated blood to the victim's brain and the heart, dramatically increasing his chance of survival. CPR timeline 0 to 4 minutes, 4 to 6 minutes, 6 to 10 minutes, over 10 minutes. When a person experiences cardiac arrest, the heart goes from a normal beat to an arrhythmic pattern and eventually ceases to beat altogether. In essence, CPR, cardiopulmonary resuscitation, serves as an artificial heartbeat and an artificial respirator. Please remember that. Do not leave the victim alone. Do not try make the victim drink water. Do not throw water on the victim's face. Do not prompt the victim into a sitting position. Do not try to revive the victim by slapping his face. Let us now learn about the ABCs. Airway. In ABC, A is for airway. If the victim is unconscious and is unresponsive, you need to make sure that his airway is clear of any obstructions. The breaths may be faint and shallow. Look, listen and feel for any signs of breathing. If the person is still not breathing on his own after the airway has been cleared, you will have to assist him breathing. Breathing. B is for breathing. Pinch his nose with your fingertips to prevent air from escaping once you begin to ventilate and place your mouth over the victim's, creating a tight seal. Keep an eye on his chest. Give 2 full breaths. Between each breath, allow the victim's lungs to relax. If the victim remains unresponsive, check his circulation. Circulation. C is for circulation. In order to determine if the victim's heart is beating, place 2 fingertips on his carotid artery and apply slight pressure for several seconds. If there is no pulse, then the victim's heart is not beating, and you will have to perform chest compressions. When performing chest compressions, proper hand placement is very important. Place one hand on top of the other and interlace the fingers. Lock your elbows and using your body's weight, compress the victim's chest. The depth of compressions should be approximately 1.5 to 2 inches. Check for responsiveness by shouting and shaking the victim. Call for help. Check for pulse and if necessary perform the cycle again. If there is no pulse, continue performing 15 compressions to breaths, checking for pulse after every 4 cycles in the span of 1 minute until help arrives. Thank you for participating in this first aid training. Remember that your safety is crucial not only for you, but also for people around you. Consider safety, act safely.